Around 1,500 junior doctors who applied to be placed for mandatory internship at public health facilities in the next year are reportedly stuck in limbo. This comes as the country gears up for another wave of COVID-19 infections, now driven by the Omicron variant. Earlier this week, government continued to urge South Africans to get vaccinated, with recent statistics revealing that more than 80% of patients who are currently admitted at hospitals in Gauteng have not been vaccinated. To talk more about this, we're joined by the Chairperson of the South African Medical Association, Dr. Angelique Coetzee. Dr. Coetzee, always great to have you on the program. So, according to News 24 and the Junior Doctors Association, some 1,500 intern doctors are waiting for placement. This is not a new problem. Why does it keep happening?
Good evening, and a good evening to all the listeners out there. Yeah, this is a 10-year ongoing problem, but it's a much more complex problem than just to place the interns and say, placed and let's go and get you to work next year. So I'm going to be quite blunt about what we think the problems are, and then there's the solution. How can we solve this? So I think first of all, we need to understand that if you announce placement of interns, at this case we're talking interns, it is similar as if you now are committing to employment. So first of all, National Department of Health doesn't have the purse string. It's not lying with National Department. It's lying with the provincial DGs. The next problem is there is no money. Doesn't matter how we look at it, there is no money, and we can come back to that now. So if at provincial level the DGs commit to placement of interns, even to tell them that you will get your position at Hospital X. There's a requirement in law that there must be funds available. You cannot authorize an action to purchase or to pay someone if there's not enough money in that budget. So the provincial DGs are sitting in the same problem. The moment when they allocate those placements and there's no budget, there's no money, because there is no money. Let's, again, be blunt, be abstract, and let us all understand that. They will, according to that requirement and law, they will be held responsible at parliamentary level, and they will be investigated. So they don't want to commit. The other thing is, even if they commit up until the end of March this year, coming 1st of April, because they might scrape money together, steal from one department or one, from medicine or from wherever, to have enough monies up until March. Come 1st of April, and Treasury didn't give them the budget. They then need to terminate. Technically, they have to terminate that post. We can 1st of April. So there's a money issue, a huge money issue. And we all know how many interns need to be placed. That is something that's been ongoing for many years. It's been worked out. So that's not the problem. The problem is COVID came. We saw the stealing and the corruption going on. We saw the ineffectiveness. But also, Treasury is responsible for allocation to all departments for money. Mm-hmm. And Treasury must have enough budget. So if Treasury is not coming to the party, the National Department of Health, but more so the provincial departments of health, are in limbo. And this is where we currently are.
So, Dr. Coetzee, why is the money then not being brought forward if everyone understands that that is what is needed?
Because our taxpayers' platform is not enough. There is not enough people working out there in the public and everywhere. There's not enough job creation so that taxes can be paid, so that Treasury can get an income, so that we can pay salaries. So you cannot expect 5% of the population to food the whole country. Can't do that. There's not enough. The bottom line is there's not enough people paying tax. So people need to pay tax. There need to be more jobs, job creation out there. Salaries need to be reduced in the public sector. Not even putting a moratorium on it. We need to get money from somewhere to pay for essential services. Also understand that every intern, their annual salary is 700,000. With overtime, you're looking at 1 million per intern. So if you look at 1 million per intern with overtime, more or less, and you look at 1,500 people, you understand what is the money concerns around that. And then there's still the ComServes, and there's still the other budgetary needs. But the country doesn't have the money currently. It's not enough for taxpayers.
What then, Doctor? Is it that these 1,500 intern junior doctors just have to accept that they're not going to be placed?
Well, everyone is trying to scrape money, and there's no huge pressure from the Minister of Health to the Minister of Treasury to say, please, let us look, because we are that is a statutory requirement to place these interns. But now again, you have to understand that the provincial DG who sticks his neck out and plays them will be held accountable. And, if there's not money, if there's no money in the budget. So it's really a huge, huge problem. The second thing is SAMA also looked at, should we take them to court? Should we start a court case in this and see what we can do to try to resolve the problem? Well, the bad news is, once if you start a court action, all that you're going to do is you're going to prolong any further discussions, where you will still have maybe trying the National Department of Health trying and asking Provincial Department of Health, where can we, I call it steal money because it's really stealing money from somewhere else. So maybe we're going to get PPE that is not maybe at the right standard. Maybe we're going to have less something else that we need to pay these salaries.
You know, you say, Doctor,
it's a huge problem.
Pardon me, you say you don't want to, for example, as the South African Medical Association, go to court because that will stall the progress further. But for the many junior doctors who are waiting for placement, who cannot begin their careers really without that part of their qualification, they feel, some of them, that you should be fighting for them harder.
Well, I also want to encourage these interns or the newly incoming interns to belong to SAMA. Because if we look at the number of them belonging to SAMA, I think it's about 200. So out of those 1,500, if 1,500 belongs to SAMA, it would help us a lot to go and fight for them. But you know, 200, I don't have the exact number, but that is the interns belonging to SAMA currently that we have. I think it's between 200 and 300 interns. So they also need to play their part. If we are already trying to fight, and we had numerous meetings with National Department of Health, and again, the fact of the matter is, if there's no money, then there's no money. And if we go to court, for 200 interns belonging to SAMA, and we prolong this process, and in the end of the day, it's going to be kicked out, it might be a year later that these interns then sit and wait. So it's still, you need to try to negotiate as much as what you can. But Treasury also needs to wake up. It's a wake-up call for Treasury as well. And I understand that Treasury also you have a problem getting a budget. and allocate budgets to the Department of Health or to healthcare. There's a huge cut in healthcare expenditure. And on top of it, we sit with the vaccines that also needs to get paid.
Mm-hmm.
And we have only so many taxpayers where you can get money from.
And you know, Doctor, what makes this worse, I mean, we're speaking about the careers of the junior doctors, rightfully so, but this is also especially unacceptable when you consider the fact that South Africa is sitting with a crisis where we do need more medical workers. We do need doctors because you've still got hospitals and clinics where the patient-doctor ratio is simply unacceptable. You've got a situation where we're dealing with a pandemic where health workers are themselves testing positive and need to take time off. And when you don't have enough on rotation, it has real-life implications for the patients, right?
I do not dispute any of that. That's true. But, you know, if there's no money and people, and that's what we hear. And I believe them. There's no reason why I should not believe that that there's a budget problem to pay 1 million plus to 1,500 interns. They need to get the money from somewhere. Treasury was aware of how many people needs to be placed. But there's COVID. There's a lot of other reasons why this is even more a bigger problem than we anticipate. We need to look at spending money to send students to Cuba. Why can't we keep those money in the country and train those students here? Why can't we make that money available to the country and add the value back into the country? So we also need to look at that. That is a political decision. So it's a huge problem. And I feel very, very sorry for these interns. But I do understand the moment I put a placement out there, you stick your neck out as a provincial DG to be held accountable and to be investigated. So it's between a devil and a deep blue sea. We know the interns must be there, but it's also important to understand that these interns are interns and they're still there to study. They're not there to do the work of everyone else. They're there to do their rotations. They're there to still be trained. Mm-hmm. And they're not there to only see COVID patients. They've got a much bigger role to play than that.
If I can ask you a final question then, ma'am, about still with the intern doctors. You mentioned Cuba. There are South African medical students who went to Cuba. Some went to study in Turkey. Some of them are saying that they're experiencing hardship even just registering with the Health Professions Council so that they can get some kind of process underway. How big of an issue is that, to your knowledge, where the ones who studied abroad are unable to get any sort of registration so that they can do, I understand that they have to do an additional year in South Africa?
Yes, it's true. They need to do an additional year, even if you study in Cuba, and even if it's a political decision why you should study there. And that, again, we need to support those students studying in other countries. We need to say, why are there budgets to send them out of the country? Well, if we look at that money and what it cost us, maybe we can place more interns with that money and keeping all those students studying abroad. Why can't we bring them back into the South African context where we don't need to pay them a monthly fee to get the food and housing, where they can study from home, they travel, or we can get them into complexes where they can stay. We can use that money to help the healthcare here. So don't have a problem with the student. The student is unfortunately caught in the middle of all this political madness that we are seeing currently. And we need to relook at everything. It's going back to the drawing board.
Dr. Angelique Coetzee, it's a conversation that could go on all night. For tonight, though, thank you very much for your time. Always good to speak to you.